no hurry to resume economic activity, opting instead to listen to the science.
That's right, yes, possibly chastened Boris Johnson, keen to show that he is back in charge, describing this as the biggest challenge to the country since the war. The context to all of this is some in British business, some in his own ruling Conservative Party, and perhaps even his own Chancellor, and certainly sections of the press wondering when will the lockdown end and when will the economy be once again set free. You heard the Prime Minister's analysis there. He would like to get things up and running again. He understands people's frustration. But in the end, what the government wants to avoid now at all costs is the possibility of taking the brakes off, letting the infection once again spread, and being forced to impose new restrictions during a second peak, which, as you heard Boris Johnson saying there, would end up causing even more lasting economic damage. The other context to take into account is the fact that the United Kingdom, not as far into its outbreak as countries like France, Italy, Spain, for example. Boris Johnson is saying that, yes, the curves, the statistics are starting to go in the right direction, but the UK public needs to remain patient, likely for a few more weeks in terms of getting those curves back down to where they need to be before restrictions can be relaxed.
Now, Chris, Boris Johnson said the UK has averted a disaster. Is that a fair assessment?
Well, you heard him talking during that speech about how the NHS had largely held up in terms of beds and ventilators. That said, his government has come in for heavy criticism on a number of fronts. First of all, you mentioned it yourself, over protective equipment for frontline healthcare workers. There's also been this ongoing issue of testing, the fact that the United Kingdom has carried out a relatively low number of tests compared to, for example, Germany, but also compared to a lot of other European countries. It looks unlikely that it's going to meet its target of 100,000 tests being carried out by the end of this month. And then there's the issue of the government's overall handling of the crisis, the fact that it seemed for so long, for example, to toy perhaps this idea of herd immunity before changing tack and imposing the lockdown, but doing so at a much later stage in the outbreak than many of its European neighbours. Boris Johnson is keen to look forward, to focus on phase two, as I said, at a time when many are wondering when the lockdown will stop, but really preparing the British public, like many governments have been doing, that it's not going to be a case of back to normal, either in terms of people's daily lives or for business anytime soon. Yes, there are hopes of a vaccine being developed, but the government's been saying in all reality that's unlikely to be available until next year. As the UK's Chief Medical Officer, Chris Whitty, said on a couple of occasions recently, many of the measures that form part of the existing lockdown, particularly social distancing measures, working from home, etc., are likely to be a reality until the end of this year at least.
Chris, thank you very much for the update. Chris, more reporting there.